I'm going to show 3 exercises, okay? So 3 exercises, and this is number 1. This is the starting position, okay? Starting position, this is going to be a back bridge, okay? So when would I recommend the back bridge? All of these exercises I would recommend to my patients after they've been under some care for some time. So they may be a patient that has a disc bulge injury, an L4, L5 disc bulge, an L5S1 disc bulge in the lumbar spine. They may have a low back or lumbar spine sprain strain, may have a sacroiliac joint dysfunction, or a sprain in that area, or they may have a sciatica, leg pain, a numbness in the legs. So when we want to rehabilitate the back, these are great strengthening and conditioning exercises. So this is a starting position. So I wouldn't start someone off with these exercises right immediately when they're in acute pain, when they have trouble walking and bending and moving. This is more down the line. So I usually start people off with stretches and mobility work, and then some entry-level core back exercises and strengthening exercises, and then again to more intermediate that eventually advanced if they can get there. So this is more on the intermediate side. So I wouldn't start this right away with patients. It'd be more probably 2 or 3 or 4 weeks into care, okay? So starting position for the back bridge. You lie on the bed or on the ground, and you're gonna hook your knees up. So put your feet on the ground and bend your knees. So you bridge yourself up, okay? So that's the bridge right there. Okay, now you could bring your knees over here more at 90 degrees, okay? I'll give you a couple of nuances you need to know about this. This is very, very important. You see how my body is straight in line with my thigh, okay? This is like a reverse plank, if you want to call it. And what you're engaging here are the gluteal muscles and the hamstring and some back extensors as well, okay? So the gluteal muscles are very important stabilizers. Actually, they're more extensors of the thigh, but they need to be strong because every time you walk and you're propelling forwards, when you walk, you have to extend your thigh back. If they're sleepy and they're not fully activated with all their muscle fibers being fully activated, which is probably the case in 95% of my patients that I see with chronic back conditions, then the low back muscles have to fire first with that extension motion of the thigh, okay? So when you rehabilitate the gluteal muscles and as well as the hamstrings, you're gonna take extra load off the lumbar spine muscles, so it helps the back to recover. So it's a great exercise. And you bridge it up just like this, okay? So go back to a starting position, and then you're gonna bridge up just like this. And the knees could be a bit more 90 degrees. I'm a bit more out with the feet, so they can be more under here, okay? Either way works, whatever is easier for your knees, okay? Now, so I wouldn't start this off when someone has immediate or acute pain, okay? I wouldn't start that off right away. I would do this later on as the pain is beginning to subside and minimize, and they're able to do this more, have more functionalities to do this, okay? What you can do for the back bridge is you can hold it for 1 second, okay? So you're gonna hold it up for 1 second, so 1 count, 1, and then you come back down to the starting position, okay? So that's one way you can do it, okay? Hold it for 1 second, and you repeat that 10 times. Start off with 1 set, 10 reps, work up to 3 sets, 10 reps, okay? So start off with 10 and then work up to 30. Break it up into 3 sets of 10 reps eventually. And then you take like maybe a 10 second break in between sets. That's one way you can do it. Or you can do maximum hold, okay? So maximum hold that for 30 seconds, maximum, hit until you fatigue to your maximum, and eventually try to work up to 60 seconds, which is 1 minute, and then 90 seconds, 1.5 minutes, and then 2 minutes, okay? So that's 2 ways you can do it. How many times a week? Because it's a strengthening exercise, I usually tell my patients to do it 3 times a week. You don't have to do it every day. I don't think there's any harm to doing it any day as long as it doesn't cause any discomfort to the low back. So at least 3 times per week is good, okay? When it comes to stretching of the lumbar spine or different stretches, I like to do stretches daily and mobility work daily, but strengthening exercise like this 3 times a week is enough, okay? Exercise number 1. If you guys are liking this, let me know in the comments. The chat box is open. Let me know in the chat box if you like this. I'm gonna go to exercise number 2 now. Okay, this is exercise number 2, starting position. We're gonna get into the prone plank, okay? So prone plank position. So start position, you're lying down, prone, okay? On your stomach, on your chest, your hands are to your side, okay? And then you prop yourself up onto the elbows, okay? So the purpose for the plank is, again, to engage the glutes your extensors of your back are also engaged, but now you're also engaging the abdominal muscles. So abdominals are a very important core exercise, core stability muscles. And what this does is when the abdominal muscles are well maintained and strong and tight, then it helps to keep the core well contained, the intra-abdominal pressure well contained. It helps to stabilize the core in the back and helps prevent injuries. So it's very, very important, okay? It also engages the glutes. Now, a couple ways that people do this wrong. Okay, let me show you the wrong way first, and I'll tell you the sets and the reps and the amount of time to do it for. If you begin to dip down, so you're losing the plank, begin to dip down, then that's cheating, you're fatiguing, then you need to bring yourself up again, okay? And so let me go here, pointer. So if you're beginning to dip down, okay, you're dipping down. If you're TPing up, if you're bending upwards, like a teepee or a tent, you're also cheating. It means you're fatiguing out. So that's not going to be a good way to do a plank. You need to plank yourself and activate the abdominals and the glutes at the same time, okay, plus the back extensors. All right, so start like this, and then you prop yourself up on your elbows, okay? See how the head is lined up with the shoulder, lined up with the hip, lined up with the knee, lined up with the ankles, and you're up on your toes. Full body engagement. You even get some extension into your neck. You can also look up if you want, not a full extension, but in front of you. But having your head neutral like this is good too, okay? So very, very good exercise, standard low back exercises, okay? And this is how I recommend to my patients. So prone plank, this is a sustained hold or a max hold. I usually start them off at 30 seconds, see what they're able to do, and then eventually work them up to 2 minutes, okay? You don't just go up to 2 minutes. If you can do a prone plank for 2 minutes, that's pretty good. Of course, the longer you do it, the better, okay? But 2 minutes is really, really good, okay? Minimum 2 minutes should be the benchmark. So 30 seconds if it's still new, and if you're shaking and TPing or tenting or dipping down, then you got to stop and reset, or just, let's say, master 10 seconds or master 15 seconds or master 20 seconds, and then you work up to 30, 45 seconds, 60 seconds, 90 seconds, eventually 2 minutes, okay? 3 times per week is fine. And one of the most common questions I get asked on my videos is, when do I do these exercises? What time of the day do I do them? And there's really no really best times. Whatever works for you. It can be done in the morning, afternoon, or in the evening, okay? So as long as it gets done in the day, whatever works to your schedule. Sometimes people wake up with back aches and pains and they feel better in the afternoon. So do it when you feel better in the afternoon, okay? Sometimes people go to work and they feel worse in the afternoon with their back, then it might be better to do in the morning, okay? So it's individualized, all right? Awesome. Let's go to the third and final exercise. Okay, next exercise, prone plank. Now we go to full plank. Okay, so starting position, just the same, okay? Full plank. Okay, so you see again on the toes, okay? So on the toes. Now full arm out, so you're resting on your wrists. Again, head lined up with the shoulder. Your back is completely erect and lined up with the hip, the thigh, the knees, the legs, and the ankles, okay? So now you're up on your hands. A bit more difficult, this full plank, okay? A bit more difficult, all right? Okay, so now again, because you're higher away from the ground, there's more gravity. The effects of gravity is acting more on you because of the distance. So it's a bit more challenging. The arms get fatigued. Okay, you have to balance yourself on your wrists. If you have wrist issues, you have to be careful. Shoulder issues, you have to be careful. Elbow issues, you have to be careful. Okay, but engages your extensors of your back, very important. Also, your neck's engaged. You're contracting your abdominal muscles. You're contracting your abdominal muscles, so you're engaging them, right? You want to activate them. Later on, you might feel a little bit of a burner, abdominal ache because you've worked those muscles like a workout pain. That's fine. You're engaging the glutes. You want to contract and squeeze the glutes, okay? Very, very important. And then balance on your toes. Okay, so lots is going on here. Very, very key, okay? So that's the full plank, okay? So again, same idea. This is a maximum hold exercise, okay? See what you can do. Start off maybe with 10 or 15 or 20 seconds or 30 seconds, and then work up to 2 minutes. You'll be able to do a full plank for at least 2 minutes, okay? 3 times per week for strengthening again, and any time of the day that works for your schedule, okay? Awesome. Those are the 3 exercises I have.